AI and healthcare. It's like peanut butter and jelly. And I know we've been covering a lot about AI recently. There's been a lot of stories we've been publishing. But on this episode, I've got an AI story that we really haven't talked about as much. I'm about to sit down with the team from AGS Health. They have deployed AI technologies internally at their company to make them more effective and efficient. They call their AI technology the Intelligent RCM Engine. I wanted to find out more about what that is, how the company itself has benefited from it, and what their customers appreciate most now that AGS has it. Let's get to it. Gentlemen, welcome to the program.
Thank you very much for having us.
Yeah, thank you very much. It's a pleasure to be part of this program.
Yeah, I'm excited to dive in with you. But before we dive into today's questions, Ryan, can you introduce yourself and tell me a little bit about your role at AGS Health?
Yeah, absolutely. My name is Ryan Christensen. I'm Executive Director of Product Management here at AGS Health. My focus is going to be on the AR technology, our back-end technology that helps us manage the claims processing and AR for our clients. My personal history is I've been in technology for a long time in a broad range of industries, everything from, of course, healthcare, focused specifically on claims like we are here, or I've also done things within HIPAA compliance. I've worked in the dental industry. I've been in HR, and I even helped build out some technology for women's hair extensions, of which I'm a great expert, as you can tell by my hair. So yeah, I've got a lot of fun focused on technology, specifically here at AGS around the AR side.
Thanks, Ryan. John, over to you. Can you tell us a little bit about your role and then also tell us a little bit about AGS Health?
Sure, absolutely. I'm a Senior Vice President of Operations. I've done operations for my living throughout 23 plus years, predominantly in the BPO space and, 10 plus years in healthcare now. My role is I head AR vertical, the accounts receivable. Cash is king, and I have the big responsibility here to get cash, for my customers. So that's my role. I have, close to 4,000 employees working, across the globe, predominantly in India. And we also have operations in Philippines, where they exclusively do, patient AR work. So that's, my role. And to talk more about AGS, it's one of the great organization to work with. In my experience of working in BPO, technology is key to our success. We are a service company, but one thing that differentiates AGS is we always wear technology hat and look at things. So we don't treat ourselves as a service-based organization. Instead, we look at as a technology organization, which helps us help our customers. As you know, there is so much of technology changes happening. Today it is AI, then generative AI. So it's just changing every time. And then by the time you understand one technology, there is a new technology. So that's why we are always trying to stay ahead so that we can help our customers and take care of the patients. So we love working in AGS because of that culture. And we are proud to serve all these hospitals, and the physician groups that we serve because we're able to help them, collect more, and that actually helps them to manage the community.
I love how you put it. Cash is definitely king, and AR right now is a super hot topic because of all the revenue and margin challenges that we have in healthcare.
Mm-hmm.
But that is actually not what we're diving into, although it is related. The topic du jour, of course, is AI. By far the hottest topic in any industry, but certainly in healthcare. And I think over the last year and a half, I've done so many stories about how AI can be deployed at healthcare organizations, but what we haven't heard as much about is how healthcare vendors, healthcare partners like yourself are actually deploying AI internally to improve the service that you provide to your clients. And when I heard about AGS and how you're using AI internally, I just felt I had to get this story because we don't hear about this a lot. And so I understand that's exactly what you've done. You've implemented AI to improve some of the be more effective in the ways you help your customers. I think what you called it is you have an intelligent RCM engine working at AGS. Can you tell me more about that?
Yeah, absolutely. The Intelligent RCM Engine has had a couple of different names throughout its history, but we like to identify it as such because that's really what it is. It's an RCM engine with some intelligence behind it, or AI. Of course, I like to separate out AI from automation a little bit and point out that they work in tandem, right? And that's what the RCM engine is and does, is it leverages automation to be able to simplify and speed up a lot of processes. It's not all AI, but the automation is what makes it seem like the AI is really, really powerful. And so we start with that, and we make sure that we get the process in place to be able to speed things up, right? Information gathering, claim allocation, getting the right claim to the right person at the right time to do the right thing. And that's where automation really comes into play. And that's where it started. But as we talk about AI, that's where it's gone. That's where it's come to now, right? And there's a lot of different services, and us as an organization, we recognize there's a lot of technology that we can either build or that we can partner with people to better serve our clients. Things that allow us to be able to take those claims that we know needs the right amount of information or the certain kind of information. We've got millions and millions and millions of data points to learn from. Great. Well, we have machine learning, we have automation that then allow us to be able to leverage AI to do what? Well, be able to gather the right information, put it into the right place, identify a claim that says, okay, we don't even need human interaction on this. We know what needs to be done. We can even create an automatic appeal. And so that's what we're leveraging AI to do, is to take all of this information that we've already gathered, use this automation to be able to assign the claim either to a human or to one of our AI systems to go out and say, all right, this claim has been denied. Here's the reason that it's denied. Let's go ahead and create the appeal, resubmit it, and get it back into the process to gather more money. All right, well, where else can we do it? Now that we know that this claim's been denied, we can actually go back and look at the beginning. And so we're going to now start looking at claims from the very beginning and know whether or not, hey, there's a high likelihood of it to be denied or not. And that's where those data points come into play. And that's where it really starts to leverage machine learning to start to say, okay, here we go. Let's take these steps ahead of time. And now we have all of our associates, the people that John's been working with and making a really strong team, can actually go out and say, okay, not only do we have automation, but we have all of this information. Let's communicate. So now we have a chat bot that allows our associates to communicate directly with a bot that says, okay, well, what's the next best step here? What do I need to do based off the information? The bot says, okay, go and do this or do that, or assign it to one of our digital workers, as we might call them, to get the task done. And so that's where we go out and we say, all right, where can we do RPAs? Where can we do machine learning? Where can we even do something like an intelligent dialer that will make a phone call for us? So for us, we look at all the elements of AI. So to kind of make it in short, it's about using automation to identify what a claim needs, and then building the software, whether it's taking all those data points, putting into machine learning to be able to generate appeals, or partner with someone who can do an intelligent dialer for us that can cut down the time that someone spends waiting on hold. Because at the end of the day, our clients are really excited to get the work, but what's the best part? You kind of mentioned cash is king, right? It really is what gets in the door, how fast, and when. Do they care that much about how it gets done? I think they think it's really cool. But the most important part is the speed. And that's where we try and find the right partners and the right technology, whether we build it in-house or just find someone that we can work with to do each of those different elements. And that's really kind of helped the baseline of our AR journey.
So guys, I just want to ask a question about this, because that's very interesting. I heard that you just mentioned you're using internally a chatbot that your own staff can interact with. Can you expand on that a little bit more for me? Because that's really cool.
Absolutely.
Yeah, so, John, I'll jump in, then you can kind of talk about the thing. But one of the things
Sure.
I want to say about our chatbot is it's specific to each client. It isn't just a chatbot that's for AGS Health, but it's AGS Health for each of our clients. So we build custom rules, custom information for every client around what that client needs. What are their claims like? What are their denials like? So when one of our associates is working through a claim or wants information and they're communicating with our chatbot, they're talking with our bot that's for that specific client, not just general information. And so that's one of the things that allows us to be able to build a real engine that our associates can interact with, but specific to a client, not just a broad, okay, here's the general information about the industry or about the claims.
What is it that I'm typing that someone would type into that chatbot? What kind of questions would they be asking?
Well, where do I look for this specific type of information? Hey, I have this. What's my next step? I know that this claim was denied for this reason from this payer. Okay, what's the next step? Do I need to do it? And then that bot might include a form. It might tell them the next step to go to. It might tell them to go to the payer portal and gather more information because we need it if they're unsure of the next steps to do. And it's just, hey, here's my claim. It was denied for this reason. Here's my data point. What's next? Here's what's next. And it'll be specific to that client.
John, I know you want to jump in there. Go ahead.
When we did a pilot testing, everybody who were bottom performers, we picked them and said, let's infuse technology and see how they are performing. And within a month, all of them were able to meet their quality standard. So that's how powerful this is. So every scenario, every denial scenario is embedded into the chat tool. So any question I ask about any denial, let it be coding denial, or let it be medical necessity or prior auth, any denials, I just go and ask about the denial. It starts asking me questions and leads me to the right action. And even within our organization, we now want to use it. Everybody likes it. So as a self-help tool for our internal teams. So that's how powerful this tool is today in AGS.
Ryan, thank you for that. That's a great explanation. So can you boil it down for me, guys? How has AGS Health benefited from your Intelligent RCM engine?
That's a good question. Our customers outsource to us, and for us to complete the work, we got to be efficient. And efficiency is very, very important for a vendor to be successful, right? So we got expectations on productivity, right, and the right quality. So a good vendor has speed and accuracy together, right? I hear a lot of feedback from customers saying that, hey, we worked with a vendor who is not able to produce the quality or struggling to meet the productivity expectations. So when they come to us, they're able to see that we are able to do both, right? Speed and accuracy. And technology is very important for us. So that's why this AI is key for our success. And today we are able to stay ahead of being efficient and also getting best quality for our customers. And over a period of time, we were able to reduce the headcount that we were deploying in some areas where customers do control the inventory. And then when we get the work, some customers say that we want you to work on this, but the efficiency can be gained only when we deploy a strategy and using our tools and technology. Like Ryan was explaining, my tool will decide who should work on what claim so that I can get the best outcome, right? How soon can I resolve it? And how soon can I get the cash to my customer? Because for every payer, there are some nuances that we understand by working with several payers, by talking to them. So we know which payer will pay faster, which payer will take more time. So all that intelligence is actually built into our system. So our AI-based system really helps us to drive that efficiency. In one such example, there was a customer who had a tough time managing the inventory, and because they were controlling, we were able to produce only 50% of what we should be producing. And we ended up adding more people. And in peak, we had around 70% more headcount in order to manage the volume. And when we introduced our Intelligent RCM engine to our customer, we did a demo to them. We showed, hey, this is what we have. We've invested in this to help you. And your pain point of have to maintain more logins. So when you have more people, you got to maintain more logins. And customers also do quality checks. So then they have to do more. So they have to deploy more people. So it's actually a pain point for everybody. So efficiency is gone in both client side and our side. So after we introduced, they allowed us to, start a pilot. And we did a pilot with one region. And, guess what? We were able to do more than the target after we deployed it. So customer was extremely happy. They let us deploy this across all regions. And today they're extremely happy because our 70% of excess staffing is down to 28% now. So it's a huge, huge difference, which means less logins for customer to manage, less quality issues. So not just efficiency, but great quality. In fact, we are outperforming the captive and their other vendors, and acknowledgement from the customer that our quality is great now, our productivity is great, and we are able to, exceed the expectations of our customer.
Well, and that's great. I mean, and you touched on it there. I want to dive into that more, John. But I just want to recap. What I heard is that internally, the Intelligent RCM engine that you're using is helping you be more effective, more efficient, more accurate. You're able to do essentially more with less people. You were able to reduce the number of people that you had to deploy on this one account, for an example, and it was significant. 70 down to 28%. But you touched on it there. There's some benefits to your clients and your customers as well. Like the fact that you are able to have fewer people means you just mentioned fewer logins that the customer has to manage for your team. What are some of the other benefits for your customers that manifest by you using this great tool that you have behind the scenes?
So in one of the customer, we were able to see improvement of approximately 25 to 30% in cash within 2 months. And that was purely because we were able to devise the right strategy. The moment they came to us with the pain point, we just said, please allow us 1.5 months, because by the time we take action, payer is going to take some time to pay. You can't get the payment tomorrow. And exactly how we predicted, we showed that delivery, and then every month it's increasing. They're like, wow, this is great, right? So it's really working well, and our customers are happy because they are seeing the cash.
I was going to ask, and obviously, again, cash is king right now, but is there an aspect of the intelligent engine that your customers give you the most positive feedback on? Like, is there something that they're just like, wow, I really like this part of what you're now able to offer?
It's more often than not the most recent thing, right? It's like whatever the newest technology that's added on. And I'd like to say that's always the case, but oddly enough, that isn't necessarily how it works. We do have some newer technologies that are exciting that they're building or partnering, right? And they'll see the reports, and they'll think that it's nice. But at the end of the day, it's almost like they like the simple things, right? They like something that they can really understand and then see the value of it. And one of the first automation tools, it isn't even AI from our perspective. One of the things that feeds into our AI is our allocation tool that we refer to as our CIA tool, which maybe is just the fact that the name is kind of nice because it's CIA. But this central intelligent allocation tool takes these claims that hundreds of thousands of claims, millions of claims every month that we're working on, and we can show them, hey, look, here's the claims you gave us. Here's where those claims are. Here's who's working on them. Here's the ones that have the highest priority, et cetera. And so it just puts them into as I kind of had mentioned, puts them into the right place with the right person to do the right action to get the highest probability of the highest return on that. And that's what people get most excited about, because they can understand, oh, so you get the claim to the person, or there's a place that it needs to be in a timely manner to get it done. Yes. And that's what they can really understand, because at the end of the day, when they're looking to work through all these claims, it's just like, where do I start? What's the biggest pain point, et cetera. That's what this system does. So we have all these back end data points that show us, be like, okay, here's what we need to do. And that's what they get most excited about, I think, is our CIA tool that allows us to allocate the claims appropriately, and they can really get behind that.
If I was a customer, if I'm a practice or a health organization, what are some of the signs that maybe I might be a good candidate to use or take advantage of the Intelligent RCM engine that you guys have at AGS Health?
A lot of claims that you get worked on that you get lost in the system, and they're just slowing you up, and you're running up against that deadline of being able to submit an appeal, right? Like oftentimes it is going to be large organizations that, they probably have a pretty substantial internal RCM team that helps them work on their claims. And with that, they know the complexity, they know the difficulty, and they know the challenges facing. And they've got a large backlog of revenue that's just waiting to be collected and waiting to go, have the right work done to be able to get it into the system. And so that's the first step for us when we look at it, is like, do you understand the complexity of it? If so, that means that you understand the value. And so the large backfill of claims that need to get collected is the first starting point for us when we're talking to people. It's like, do you have a lot of money waiting to get collected? Let us help you get it.
Gentlemen, you've both shared a lot of information with us today. Where can people go to find out more about AGS Health?
Of course, then go to agshealth.com, see the different areas that our expertise. We even do talk about our technology on there because it is something that, whereas we do the most of the interaction with it, people can learn about it as well. And then we've got conferences that you'll be able to find some of our representative at Greater Heartland, Becker's, AGE, IMA, that are coming up that you'll be able to see, people from AGS Health at. But at the very least, agshealth.com, and find us at some of those conferences.
Well, John, Ryan, thank you so much for being on our program today, and thank you for sharing all of the things you did.
Absolutely. Thank you very much. This is fantastic.
I want to thank Ryan and John for hopping on camera with me. I was fascinated about how their staff have access to a chatbot that is tuned specifically to the rules and nuances of each of their customers. So now their workers can know exactly what the next step is and where to find all the specific forms for that particular customer. And hey, if you enjoyed this interview, please help us by pressing that thumbs up button and subscribing. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.